Hello everyone, happy Friday. So today I would like to hop on and then explain a very common condition that's affecting people's hands and upper extremity, and a lot of people are questioning about. It's the carpal tunnel syndrome. So a lot of time when people feel like they have some numbness, tingling, and then shooting sensation into your arms all the way into your hands, and then they were told that they have carpal tunnel syndrome. And then a lot of people are just wondering if that's true and then what they should do with it. And then so that's the purpose why I came on today. So yeah, carpal tunnel syndrome means the median nerve that all the way from the neck, passing through the chest thoracic outlet to the front part of the arm, all the way into our hand. The median nerve is being entrapped or being pinched by the muscle, and then when the nerve has more tension and it's getting more angry, and then the patient usually would feel some shooting pain and then some numbness, tingling, especially at the front part of their hand, the palm of their hand. And then if in some worst cases, some people might even lose their grip strength, like their gripping would be weaker in some extreme cases. And then so this is definitely something that people should pay attention to. And then for somebody, if they have any sort of diabetes or any condition that's affecting their blood circulation, usually they would have a higher risk of having carpal tunnel syndrome, just because the nerves really need the nurturing and blood supply from the blood vessels around it. And then if somebody has decreased blood circulation, especially at the end of their limbs, then the nerves can get angrier much easier. And then so yeah, that's why diabetes is a risk factor of it. And then a lot of time when somebody is getting diagnosed with carpal tunnel syndrome, the problem is they are automatically be sent into a surgery to release that. Theoretically, if the ligament on top of the carpal tunnel where the median nerve is going into the hand is being cut and released, then the pressure will be relieved. No more carpal tunnel syndrome, no more pressure to the nerve, right? Not necessarily the case in reality, because a lot of the time it's the pressure is from the other 9 tendons also passing through the carpal tunnel. Those tendons that helps with bending, straightening our fingers, bending, straightening our thumb. Those tendons are getting inflamed because of repetitive use. The tendons are getting thicker, and then they are developing some friction inflammation. That's where the pressure is coming from. And then oftentimes, if we don't address that, we just release the ligament on top of the carpal tunnel, it's not like resolving the root cause of the problem. And then after the cut of the surgery, people would develop scar tissue, and then that can further limit the space under the carpal tunnel. And then some people would say the condition is getting worse after the surgery. So from a physical therapist and occupational therapist standpoint, we definitely advocate for any conservative treatment like seeing a PT or an OT to do some exercises to facilitate proper range of motion, proper gliding of the tendons that's passing through the carpal tunnel into our hands. And that way to facilitate circulation, that way to relieve the pressure within the carpal tunnel before going into the surgery. Usually with conservative treatment, a lot of folks we've seen here already got tremendous effects, and then they don't really feel like they need the surgery before. And then another problem that we've seen and a lot of people ask us, a pattern we recognize is that anytime when somebody feels some numbness tingling in their hands, they are automatically be put on the label carpal tunnel syndrome. But then the fact is that it's not always the case, because like I said earlier, median nerve originates from the nerve roots in the cervical spine. It passes through the shoulder, the front of the chest, all the way into your hands. There are multiple sites, multiple muscles that can potentially cause entrapment of the carpal tunnel, of the median nerve. Carpal tunnel is one, but at the forearm, the pronator teres muscle, and then also coming up here at our axilla region, the pectoralis minor, and then even getting closer to the neck, the scalene muscles. All these muscles can potentially cause entrapment, pinching of the median nerve, and then the patient can have some similar symptom of numbness, tingling they feel in the hand. Oftentimes, they just automatically got labeled with carpal tunnel syndrome, whereas a lot of chance it's not pressure here, it's pressure somewhere else. And then they might be sent into a surgery and then do a carpal tunnel release, whereas the entrapment, the pinching side is somewhere else. So apparently in that case, surgery wouldn't be fixing that problem. So that's the important thing of a proper evaluation prior to starting any treatment is very important to find out the root cause of the problem. And that's why at Core Therapy and Pilates, we always let the patients to do a discovery session when they first come in to see either me or Steven, so that we can really spend that time to evaluate and then know the client's condition better, and then do the most accurate and relevant treatment accordingly. So that's just a little bit of introduction about carpal tunnel syndrome, the most common condition of the upper extremity. And then if you guys have any questions, my name is Andy Tseng, physical therapist and occupational therapist at Core Therapy and Pilates. Feel free to contact us through our phone number 512-215-4227 or our website therapyandpilates.com, and then either myself or Steven would be happy to speak with you and then to address any of your concerns and then potentially work with you and help you get better. So that's what I got for today, and I hope you guys have a great day. Happy weekend. We will talk soon later.